Let's talk about health, Your Excellency. When you decided to declare a state of emergency in the health sector, many across our country were surprised because they've always felt that Akwa Ibom was much better in terms of provision of health services than so many states in our country. You have 468 primary health centers. You have 43 general hospitals. That is much better than what we have in many states in our country. What did you see that led you to declare a state of emergency in the health sector? Or were things way better than Nigerians knew? What prompted you to take that decision?
Thank you. The decision is not because we don't have facility or infrastructure. Largely, we don't have the human capital. And it's not an Akwa Ibom problem, it's a Nigerian problem. You all know about the popular Japa syndrome. Most of our health workers finish, and then they just leave the shores of the country. And so over time, you have had the death of human capital. And so governments, we have health facilities, and I've been to some of them. But unfortunately, we don't have enough manpower. So we need to face that squarely. Otherwise, you just have nothing but a building. No matter how wonderful a health facility is, you don't have human beings to run them. And you just don't wake up and become a health worker. It takes training. So what have we done? We've declared state of emergency in our health sector to be able to ram up the human capital that we need, doctors, nurses, other medical people. So there is the first thing to close this gap. A lot of people are retired from civil service in the last few years. So we have said, okay, those that are retired and are still strong, let's bring them back. Those ones are not likely to want to japa immediately, or they are retired. So, but if they are still strong, there are people you call retired but not tired.
Yes.
So bring them back on a special scale. Let them be hired. Let them work, so as to begin to close that gap. But while we're doing that, we're also opening up our School of Health Technology, School of Nursing and Midwifery, School of all of that, and see how we can bring in new intakes. And from the time we bring them in, we put them on a special scale. That is, they are already staff of government. That's to also encourage them, because it must be, you must you must give them some incentives that will make them stay. So we bring them in, then see how we have opened up. I had earlier approved that we engage 1,000 health workers. We met at the State Executive Council and said, let's increase it to 2,000.
Okay.
So they can come on board. We are prepared to discuss their welfare, look at training for those who want to go for specialized courses. But, like they say in this advert, terms and conditions apply.
Yes.
If we have to train you with government funds, we will expect that you sign a bond with the state government, that when you come back, you put in a certain number of years to be able to train other people, yes, or also put in that service. So that we don't just finish training you and then you're gone. Then we start all over again. All of this arrangement is what I believe it takes about, for a nurse, it takes about 3 years, minimum, to turn. So we feel that if this retirees come in, they close the gap, while these new ones come, and there can be a systematic transfer. then we are recruiting 2,000. We look at their welfare and make it encouraging. You know, how much is a doctor earning in Akwa Ibom? How much is a doctor earning around the South-South? How much is a doctor earning at the federal? What can we do? Can we provide them with allowances or something to make it attractive for them to stay in the state?